Committee will come to order. And before we get started today, I want to thank the committee members for all the hard work they did on the Blue Water Navy. This has been a passion of this committee and mine and Mr. Walls for literally the whole time I've been in the Congress. And this committee delivered by voice vote. And then yesterday, I think proudly we can say we made our case. We're 382-0. Finally, this wrong is being righted, and I want to personally thank every member of this committee for the work you did, the dedication on both sides of the aisle. So from me to you, thank you. Thank you all for being here today to discuss VA's Electronic Health Record Modernization Program. Much has been said and written about the program since June 1st of last year, when former Secretary Shulkin announced his decision to commence negotiations with Cerner. Opinions have been formed and conclusions have been drawn. The reality is, even with the contract awarded and work underway, we are at the beginning of the beginning. We all know the broad strokes that led to the HR modernization. The VA IT budget is consumed by operations and maintenance costs. VA's health information system, VISTA, is functional but increasingly complicated, while the EHR industry continues to evolve. Also, it is well past time for VA and DoD to achieve seamless interoperability, because service members and veterans deserve a lifetime medical record. I've heard Mr. Walls say that for 10 years. VA leaders were guarded in how much they would discuss during the negotiation. To some extent, that's understandable, but it's time to delve into the details. $15.8 billion over 10 years, including $10 billion to Cerner, is a staggering number for an enormous government agency. That's $15,800 million when you put it in terms like that. I don't know about where you're from, but where I'm from, that's a lot of money. However, EHR software is only a relatively small part of the overall price tag. What exactly does all that money buy? Everyone here today knows the adage: if you've seen one VA hospital, you've seen one VA hospital. Part of the reason for that is, for 35 years, VHA has had a culture of creating software to fit any process and a technology platform, VISTA, that facilitated it. There's much to be said for local authority in healthcare. I agree with that, but it seems to have gotten out of control and made the IT landscape ungovernable. The EHR modernization is not just a technology project. It will have a major impact on the way VHA operates. That means clinical and administrative workflows. It also reshapes the culture, as VISTA has. However, if imposed on clinicians from the top down, the culture will reject it, and no amount of technological savvy will be able to save it. If we were creating a veterans healthcare system from scratch, implementing an EHR would be relatively easy. But that's not the reality. Transitioning away from VISTA is the most difficult aspect of the EHR modernization. VHA and VISTA have built up around each other for decades. Amazingly, even after all these years, the department does not seem to have a complete technical understanding of where VISTA begins and ends. It's not an oversimplification to say the EHR modernization team may still be figuring out what VISTA is up and when until the day they turn it off, if ever. The scale is daunting and the ambition is impressive. That's evident. I'm interested in the benefit at the end of the 10 years to a veteran and to the clinician. The lifetime health record has to be worth the potential disruption. The ease of use, the new analytics in the EHR have to be worth the learning curve. Those things are difficult to quantify, but if the equation does not balance, it will be abundantly clear as soon as the system is turned on in the first medical center. I believe VA has been realistic about the level of resources needed to manage the EHR modernization, and by every indication, the EHRM Program Executive Office is building a good structure to do that, but they will need a great deal of help. The program cannot be seen as just the responsibility of an office in Washington. VA senior leaders, VHAs throughout the country, and Office of Information and Technology, and every other corner of the department must be invested in its success. I especially appreciate all our witnesses agreeing to testify today. It is a large and impressive group on two panels, including some new faces for the committee. You've all demonstrated an interest in the EHR modernization success. My colleagues on the committee and I are committed to doing our part. That's why Ranking Member Walz and I have decided to create a new subcommittee on technology modernization to focus on oversight of the EHR modernization program as well as VA's other enterprise modernization projects and programs. The subcommittee will allow a small group, 3 to 5 people, of committee members to focus intensively on these issues and strengthen the work the staff has already been doing. The EHR modernization is a big bet on the future of VA, and we simply must make sure it succeeds. More details will be available as we constitute the subcommittee in the coming weeks. I've been through this process from paper to electronic. It is not easy. Going from electronic to electronic, I feel, is going to be even harder. I think the technology is going to be difficult, and we have to be patient. And we certainly have to start at the supply person who's working in the ER supplying things, from the nurses who are spending way too much time looking at a computer screen and not at patients, and the doctors who are doing exactly the same thing. If it doesn't free up our clinicians and our supply people and our other people for more time with our patients, then we've failed. So with that, I yield to Ranking Member Walz for his opening statement.